Hello and welcome to Rajya Sabha Television. You're watching The Big Picture with me, Frank Pereira. Lakhs of families borrow or sell assets to receive inpatient treatment, and the government is concerned about the consequent impoverishment of poor and vulnerable families. Finance Minister Arun Jaitley said while announcing the National Health Protection Scheme that will cover over 10 crore poor and vulnerable families, or around 50 crore people. Adequate funds will be provided for the scheme, set to be the world's largest government-funded healthcare program. Coverage of up to 5 lakh rupees a family a year will be provided for secondary and tertiary care hospitalization. Under the existing Rashtriya Swasthya Bima Yojana, poor families get an annual coverage of 30,000 rupees. Several state governments have implemented or supplemented health protection schemes that provide varying coverage. But Ayushman Bharat is said to be the mother of all schemes. To further understand the new health scheme, I have with me on The Big Picture today Shubnum Singh, Chief Executive, Max Institute of Health Education and Research; Vijaya Srivastava, Special Secretary and Financial Advisor, Ministry of Health and Family Welfare, Government of India; Aditi, Tandon, Special Correspondent, The Tribune. Thank you to all my guests for joining me on this edition of The Big Picture. Vijaya Srivastava, I'd like to begin with you, of course, to understand the broad framework of this scheme.
The National Health Protection Scheme that has been announced in the budget would address in a very comprehensive manner the secondary and tertiary healthcare issues, particularly of the poor and vulnerable families in our country. And the prominent and the significant thing about this announcement is that the outreach is much bigger than what was envisaged in the erstwhile Rashtriya Swasthya Bima Yojana, basically which was catering to the unorganized labor in our country. Of course, many states such as Andhra, Karnataka, Tamil Nadu, Maharashtra and few more were supplementing the RSBY by making more coverage both financially and in terms of the categories of people. But today what the government has come up with is something that has gone way beyond all the existing schemes. As you rightly said, that we would be, the coverage has gone up from 1 lakh to 5 lakhs. The families, the number of families that we would be covering would be anything 10 crore and above, because we would be drawing the families from the SEC data of the Ministry of Rural Development to ensure that all the poor and vulnerable sections are.
So basically what you're saying is this scheme,
yes,
is a scheme that the country has never seen before, or
most certainly,
and probably even the world.
I think so, because if you look at the coverage, I mean 10 crore families plus would mean, I mean, if we take an average of 5 members per family, that would be 10 into 5, 50 crore beneficiaries.
That's the bare minimum is what you're suggesting as well. And the figure could
be
go up.
more, and it would be an expanding venture. It's not that, we would freeze the figures. This is a beginning. And actually the ultimate aim of the government is that, we have universal health coverage. And not just, I mean, of course, NHPS would address secondary and tertiary needs. But then
it's a mammoth scheme. It's
absolutely.
And it's a very ambitious scheme. We'll also talk about where the funding could possibly come for this scheme in just a bit, ahead in the program. But let me bring in Aditi Tandon into the picture as well. What is the state of healthcare in India at the moment, Aditi?
That's a very interesting question, Frank. You remind me of N.R. Narayan Murthy. He was in town to deliver an important lecture about a month ago. And he decided to speak on healthcare. Infosys founder talking about healthcare is significant.
Yes, it is.
So I will wrap up the state of healthcare in India in one sentence, quoting Mr. Narayan Murthy. And he said that health is the Achilles heel of Indian economy. And it's a recurring speed breaker in the journey towards economic growth in the country. However, that said, we have to acknowledge the fact that ours is a very big country. A lot of health goals are being steadily achieved. For instance, I must say here on record that a lot of significant achievements have been made in the front of maternal and infant mortality. We've managed to reduce infant mortality significant and maternal mortality significantly.
Several steps have been taken over the last couple of years as well. For instance, the 6 months maternity leave and so on and so forth.
Right.
So the government has been working behind the scenes, and this particular scheme too is one more step in the right direction, isn't it?
And now we also see a steady increase in funding for health. The National Health Policy of 2017 has given a direction to the government, and it has categorically stated that India has to spend 2.5% of its GDP on health, incrementally going up to 2025. So yesterday you saw the health budget, the allocation increase was about 11.50%. About 5,400 crore is the amount that has increased over the last budget. And what is more important is that between the revised estimates of the last year and the revised estimate of the current fiscal, there has been an increase in expenditure, which is a welcome trend in health, because India has a problem, Frank, of absorbing monies in the health sector. For instance, time and again, funding has been allocated to the states, but the state governments have not been able to absorb it in their systems.
Sure.
Now those absorption capacities are being created, and now the funding is being incrementally increased. In the last budget, it was 27% over the previous one. Yesterday, it is 11.5% over the previous one.
Sure. You know, coming back to this particular scheme now, Vijaya Srivastava, what is the scale of this new health scheme?
Scale, you mean in financial terms?
Just in financial terms?
Yeah, the allocation that we have this year is 2,000 crores. I mean, this year meaning 18-19. And this is a centrally sponsored scheme, meaning thereby that there's a state component also. So the broad sharing pattern between the center and the states is that the share of the state is 40%, excluding of course the northeast and the hilly states. So we will, rough estimate, over and above this 2,000 crores, we will get another 1,300 crores as a state share.
Sure.
So our kitty would be 20 plus 13 for the financial year 18-19. And we feel that of course this would be sufficient to get going. But I will also add here that, you know, based on our experience in this government, whenever the health sector has needed more funds for its initiatives, we have always been provided that additionality when required, which has been the experience in the past years as well. And we are confident that if should there be a need for more funds.
So the figure is not fixed, it can be revisited at any time, is what you're suggesting.
At the RE stage, we feel free to raise our requirements, and critical areas are always addressed in the Ministry of Finance whenever the Health Ministry raises its demands for extra funds.
Sure. Aditi Tandon, what could be the possible, implementation model that could be followed for this scheme?
There could be two models, Frank. One is the model of insurance. There you can get in both public insurance companies like general insurance, life insurance, and you can also get in private sector insurance, depending on how best you negotiate your prices. Now that will depend on the states, if I'm correct, to choose which model they will opt. As far as we've understood from the structure of the scheme which was unveiled yesterday, there will be flexibilities built into the scheme that will allow the states to choose what kind of model they want to pursue to provide financial protection.
You know, thus far we've seen that private insurance companies have been very reluctant to get into the rural sector.
Yes.
Is this going to give them some kind of an impetus to try and go into the rural sector?
See, the checks and balances will have to be placed by the state government, Frank, because let's not forget that the center is budgeting for a scheme, but the implementation has to happen in the states, because health is after all a state subject.
It is, yes.
So we cannot lose sight of that very important fact. But I must also acknowledge the fact that there are states which have done wonderfully well in terms of financial protections. To name a few, Andhra Pradesh, then you have Karnataka, you have Tamil Nadu, Kerala has done a good job. And there are some states which are now trying to set up trusts. You know, the state government is itself coming forward to set up an insurance company, if I'm correct,
trust
and
model.
taking the burden of premium and protection upon itself. So I think the trust model is what the BJP government is going to push, as far as I can see today.
Sure. Okay, let's take the discussion forward now. Do you foresee any implementation issues down the line, Vijaya?
No, I am very positive because, this whole scheme has been envisaged through a very detailed consultative process. In fact, we took some time because, when the switch over from RSBY to a health protection scheme, the discussion started, the primary concern was how to address maximum issues in the best possible manner, which is, and where, we would have states coming willingly on board. So we will, as was being mentioned, that we have gone through a very consultative process. We have, in fact, come up with, I have not had a look at it personally because it's not in my domain, but the ministry has gone through a very detailed exercise. And very soon, as was being said sometime back in the morning, that we would come up with the details of implementation, where the transition plan is being worked out very clearly. It's not going to be that what has been going on will come to a standstill and we'll ask them to implement something new tomorrow.
So you're going to phase out the old schemes and bring in this new scheme, is what you're suggesting.
There will be a transition plan. And of course, like it was being mentioned, that there are two options. One is to go through the insurance model and the other is the trust model. Our experience has been, this is based on field experience,
yes, sure,
from states which have implemented this program in a comprehensive manner. Andhra is one such state where the trust model was found to be more effective and more, easier to implement. From all angles. But we are not prescribing anything. We would leave it to the states to decide which model would they like to adopt, and we would go along with them in partnership.
Sure. Aditi, do you subscribe to the views of Vijaya Srivastava about the implementation as such, and any possible challenges that could come up?
See, as far as I see, Frank, the challenge will be to actually provide that kind of a cover. It's a very ambitious goal of 5 lakh, annual cover. And now, as Vijaya ji was mentioning, there is no ceiling. Let us not forget that the first edition of the National Health Protection Scheme was announced by Finance Minister Jaitley in 2016 budget. That time, the annual cover was 1 lakh rupees.
Yes.
A very important statement which most of us have missed out yesterday of Mr. Jaitley. When he was introducing the scheme, he said, my government has decided to take healthcare to a more aspirational level,
yes.
Which then means that the old scheme, where 1 lakh was the annual cover, was not found to be aspirational enough. So the government has, in my wisdom, decided that they will raise the annual cover so that, it's productive.
Yeah.
The thing is, the initial scheme had also said, Frank, that the family size has to be a 5-member family. But in yesterday's version of the scheme, there is no ceiling on the size of the family. So it's a progressive scheme. It's a challenging, ambitious scheme. And today, Mr. J.P. Nadda, the health minister, when he was starting his press conference this afternoon, he called it Namo Care. So I would assume that a scheme which is being named after Prime Minister Narendra Modi has to succeed.
And all the concerned people have to follow through as well.
Absolutely, and money will come.
Absolutely.
Vijaya Srivastava, what are the kind of advantages that you see from this scheme for the individuals and for the country as a whole?
See, if we look at the, none of us are ignorant about the conditions among the poorer sections or the vulnerable sections. How, people have to, enter into catastrophic expenses, whenever there is an ailment, especially, ailments like cancer or, any serious ailment. So we feel, and 1 lakh, which was envisaged earlier, it was felt in discussions that, 1 lakh is not a very big amount for treatment, for a major disease like cancer.
It isn't enough. If you look at some of these private hospitals, a small surgery like a gallbladder surgery will cost you about 1 lakh and lakh and a half.
That's 1 day's bill in the ICU of
in the
Fortis
ICU,
Gurgaon.
exactly.
Indeed.
So the thing is that, this is, addressing the fact that, these diseases are not only, people fall below the poverty line every year from anywhere from 5 to 7% because of this kind of expenses. So I mean, the ministry felt that, we should have a scheme that is realistic, addressing the issues in an effective manner, and where results should start showing. The very fact that we are not doing everything anew. I mean, we are accessing the SEC data. We are not going in for smart cards or some big high profile kind of preparedness. We will just go along with the flow with the existing database, making it as simple as possible, allowing the states to expand their existing schemes. And I'm sure no state will hesitate to come on board for a scheme that is jumping from 1 lakh coverage to 5 lakh.
Sure.
So, I mean, in
one
every
question
way,
that comes to mind when we are talking about private hospitals is the fact that will this scheme allow the people who are using it to use private hospitals?
See, hospitals will be empaneled. I mean, empaneled hospitals will be sort of there to take care of these services in addition to the public. In fact, you would also know that there has been an expansion of infrastructure in our health sector. We have aims coming up in states. We will have close to 20 aims in the next 2-3 years. 6 are already functional in the states. 14 are in various stages of construction. We have upgraded, and in this budget also we have a commitment to upgrade 24 district hospitals into medical colleges. We have been opening super specialities in government medical colleges under a different scheme of the ministry. So public institutions are also increasing in leaps and bounds. So in addition to
any empaneled hospital
and public hospital
would be
providing the healthcare facilities in the secondary and tertiary sector to these beneficiaries. And the tie-up will be very clearly made out with IT applications, so that the implementation is as smooth as possible with least red tapeism or formal.
A foolproof mechanism.
Absolutely.
Keeping the flavor of digital India in mind.
And believe me, the plan is already in a final stage.
Sure.
We just need the go-ahead from our authorities to be able to come up with the details for public knowledge.
All right. Shubnum Singh, Chief Executive, Max Institute of Health and Education and Research, joins us on the program right now. Dr. Singh, welcome. Thank you for joining us on the program right now. What do you foresee the role of insurance as well as private companies to be with regards to this new health scheme?
So let me at the outset say we welcome this. It's something which has been long awaited by the industry, and the CII has been working for the last 15-16 years on trying to put this together. Since we don't have total visibility on the detailing of how this is going to roll about, but yet I'll take a shot at to try and piece together for us, and when I say us, I wouldn't like to divide it into private and public, because I would think to make this happen, we have to do it together. And to do it together, we have to share both the methods in which we are going to address this. There's so much to be done. So it's not only private insurance or public insurance or private sector providers, whether they're large, medium or small, or public. We have to do this together, and there's more than enough work to be done. I think if there are areas of concern, the areas of concern will come from the governance perspectives, as well as trying to see whether there is a level playing field for everybody. So we have to essentially go beyond this conversation of private versus public. And I think this particular scheme has given that opportunity for all of us to work together. And if we keep going on about we will do this and they will do this, or this can be done but we can't do it because Y is not there to be an enabling factor, we'll never get the conversation or the narrative to the next piece. There's a lot of work to be done in the next couple of months. We are very, very happy to participate and make it happen, because with 1 lakh beds being required by this country to come to the international level of 2.5, as well as this tremendous opportunity for job creation, this is certainly not an opportunity for any one of us to miss.
You know, a lot of work to be done is what you're suggesting. Of course, there is a lot of work to be done. It's a magnanimous scheme. It's a big scheme. It's a mammoth scheme at the end of the day. We'll have to wait. And it's good to know that everyone is on board and on the same page and a positive message is coming out. You know, just to take the discussion forward, Aditi, you know, the tertiary sectors where, allied to healthcare and health are going to get a boost from this scheme as well, aren't they? For example, the pharma sector. You know, they're going to get a boost as a result of this scheme because, you know, more and more people are going to use hospitals. That means, the government spending is going to be taken up. So you're going to see an all-round development and an all-round push really as far as healthcare is concerned.
Yeah, absolutely. And in fact, Frank, there's a very fine balance in this budget on expenditure and allocations for the primary health sector, the secondary and the tertiary health sector. This is the first time that we've seen some kind of focus, singular and dedicated focus on primary health care in the country. Yesterday, Mr. Jaitley said that the government is allocating a lot of funding now to convert village-level sub-centers into what the government is calling wellness centers, where they are going to provide a comprehensive set of services which have never been delivered at the village level. See, right now you only have mother and child care facilities at village level. Now you're going to get into NCDs, the non-communicable diseases, and as you rightly said, as people enter the, come under the umbrella of healthcare, because most of the people are out of it. How many people can afford to pay this kind of humongous healthcare costs in the country? So once this scheme comes and people, because the premium is being paid by the government and everything is cashless and free for them, so naturally the entire allied sector is going to get a boost, pharma is going to get a boost, infrastructure, hospitals, but then don't also forget the parallel challenges that will emerge, the challenge of the human resources in health. Where are the doctors going to come from? Where is the faculty going to come from? Vijaya ji can address that question. The thing is...
Sure. I'm going to let her close the show by addressing that particular question, and also the funding, Vijaya Srivastava, where is it going to come from?
The concept of the health and wellness center is taken from the national health policy, where we say that close to the citizen's doorstep, as close as possible, we should be able to provide comprehensive services which are not just curative but preventive as well. So meaning thereby that these centers will be so equipped that apart from free diagnostics, free medicines, there would be screening for diseases like diabetes, cancer. I mean, it will develop over the years, but this is the plan. And we will also have, people, getting advised, how to prevent themselves from lifestyle diseases like diabetes and blood pressure. So if this starts happening at that level, I mean, a person whose age, say, between 30 to 40, if he has a tendency for a high BP and he gets into medical care at that stage, initial stage, so he would be prevented from, serious ailments in future, like, kidneys getting affected and other things like that. Sure. And the budget that has been committed, I mean, it is, our NHM budget has also increased by 14% over the last year. So there, now we are saying within that NHM budget, we commit 1,200 crores for these health and wellness centers.
All right.
And so that is the plan.
Okay, so that is the plan. It's all well laid out. We'll have to wait and see, how it actually falls into place and how things pan out over the next few months and years. Of course, thank you to all my guests for joining me on this edition of The Big Picture and putting things into perspective for us. That's it from me. See you again next time.